Hello, everyone. My name is Carol Howe. I'm a nursing faculty at Texas Christian University, and I'm going to allow our other speakers to introduce themselves briefly.
Hi, everyone. I'm Kate Taylor. I'm a nurse practitioner and an assistant professor over at UNT Health Science Center in the TCOM, or Texas College of Osteopathic Medicine.
Tracy?
Hello, I'm Tracy Adami. I am the Director for Research and Clinical Innovation at Medical City Dallas.
Brennan?
Hi, my name is Brennan Lewis. I'm Vice President of Nursing Excellence at Children's Health.
And Teresa. I don't know if Teresa's here. Teresa is an assistant professor at UNT Health Sciences and is with Safer Care Texas, and is also the president of Health Literacy Texas. So welcome, everyone. I can see we have some representation from the East Coast. Canada, go ahead and tell us where you're from. Also, maybe what role do you play? Because that would help us understand as we're doing this workshop. So you are now in a workshop called Innovate to Communicate. We are running it kind of as a train the trainer forum, so that you can learn how to use these materials to do training and bring it back to your setting as you see fit. What I want to do is show you at the top of the chat, I put in the link to Health Literacy Texas. This is where all the information is to run this workshop. I'm going to show it by sharing my screen. Boy, it's busy here. I'm like admitting people into from the waiting room, et cetera. So I'll try and keep myself together here. But you can see this is our Health Literacy Texas website. We have a toolkit, and this is where you'll see all the information for Innovate to Communicate. Brandon, there seems to be 5 more people in the waiting room, but I don't know if we met capacity, but why don't, well, we're only supposed to have 75, but we're up to 93. You might as well just admit them, because once we're over 60, it almost doesn't matter. We'll just work it out. All right, so here's the Health Literacy Texas website. There's a lesson plan. There's a full PowerPoint for a didactic lecture. There's videos and role play scenarios, as well as I want to point out the ARC Health Literacy Universal Precautions Communication Tools. It's a nice observation form if you want to introduce quality into your organization. And as well, we have an included Kahoot game. So you'll see what I do is when I'm going to run a workshop, I just have everything downloaded into a file for myself so that I can kind of run it smoothly. Now, the nice thing about this is this PowerPoint kind of has all the different links in it that drive you to the
Morning.
to the
webinar
different.
invite.
Hello, if everybody could mute themselves, that'd be great. All right, so I'm not going to run through this whole PowerPoint as I would if I was presenting the full workshop, but I'm going to show you the different slides so you can see them. And you can see we have objectives here, and it's really to use the evidence-based health literacy practices and really how to focus attention on how to integrate health literacy into the structures and processes and quality measures, and also how to use health literacy resources that are out there on the web. So there's lots of reasons for health literacy training, and you'd review this slide with your participants. And as well, we include some definitions of health literacy. Healthy People 2030 came out with 2 new definitions: personal health literacy that you'd be very familiar with, but they also added organizational health literacy, which is really looking at how do we as providers help patients, and how do we create programs, et cetera, so that they are health literacy friendly. All right. Again, a little bit more about the definitions of health literacy. And here we now enter into what is Innovate to Communicate and what does it all include. So we have, it's a training for all healthcare disciplines in clinical and leadership roles. There is an engaging self-learning module that we just completed, and I think will be available soon for free with a 1-hour free continuing ed credit. We have exemplar videos that we made, and we have some role plays for people to really practice some of the skills that they learn in this workshop. We also really emphasize the communication observation tools really as a way for people to monitor and look at quality with health literacy. And we have an interactive quiz, a Kahoot game. So everybody, as you're listening and moving through this, if you don't have Kahoot on your phone, you can go to the App Store and download Kahoot. You can also access it from your computer if you want to. All right, so there's the self-learning module. And here I'm going to really start talking about 2 health literacy practices that we focus on in the Innovate to Communicate workshop. The first is the medicine review. And the goal here is or the process of a medicine review is to really identify medicines patients should bring, asking them to bring all their prescription, over the counter, and complementary medicines. They bring them in a brown bag, which is why it's often called a brown bag review. And you set out all the medicines and perform the review with them, asking the patient to pick up each medicine bottle. And you can ask them, well, what do you take this for? And when do you take it? And can you show me how much you take each time? Actually asking them to show you. You can, at that point, have an opportunity to clarify medicine instructions. And when you find a problem, you can try to find out why or what's going on. It's also an opportunity to provide correct instructions, and surely you can use a teach back to ensure comprehension. The whole goal is really to find out how people are taking their medicines. And people that have conducted medicine reviews, they really find problems in almost 1/3 of the patients that they complete reviews with, either with duplicate medicines, wrong doses, taking it at the wrong time, or also sometimes contradictions in contraindications in the medications that they have with them and that they report that they are taking. This is a little different than medication reconciliation. There we tend to look at the EHR, look at prescriptions, and try to make sure that we have the right list. This is a much more interactive process with the patient and talking to them about what they're doing. All right. So what you'll see here, this next slide brings you right to a video, which I'm going to play now.
Carol, there's no sound.
When you share your screen, you have to share the video sound. You have to click the button that says share sound as well.
Miss George, my name is Ashley again. I'm the nurse who's going to be with you for the next few hours. I know there's been a lot going on lately. The next thing we're going to do is called a medicine review. It's really important that I understand what medicines you've been taking at home and exactly how you've been taking them. So I'd like to go through all of your medicines.
Oh, okay. I don't think there are any new meds.
Did you bring a medicine list or your medicine bottles with you to the hospital today?
Yes, I have them in my bag.
Great. Go ahead and pull those out. I'd like for us to be able to go through them one by one. Is it okay if I pull up a chair to sit down at your level?
Sure.
Do you know if this is all of the prescription medicines you take and also the over-the-counter ones?
Yeah, I think so. I'm a pretty organized person. I usually keep my medicines in a basket in my kitchen at home.
Good. May I look at your bottles?
Yes, of course.
Okay. Well, what I will do is enter your medicines into our electronic health record, and then I can print out for you a schedule of your medicines that would help you to fill a pillbox organizer if you'd like to once you leave the hospital. Let's go through these bottles one by one. And as we do, I'd like you to tell me what medicine it is, why you take it, and also how you take the medicine, like what time of day you take it. Let's start. You can choose the first one you take. What's that?
This one is atenolol.
Okay. And when do you take atenolol?
In the morning before breakfast. Most of these are before breakfast.
Good. Can you open that bottle and show me how many of the atenolol you take?
Yes. I take one.
Good. Let's create a done pile of medicines that we've already been through. Show me which one you take next.
The nalopril is also for my blood pressure, but I take 2 of these before breakfast.
You know what? You said you take 2 before breakfast. It looks like on this label, the instructions are to take 1 pill 2 times a day. I want you to know that this is exactly why we do a medicine review, and I'm really glad that we caught this. Sometimes if you take too many blood pressure pills, you can get symptoms like feeling dizzy or really tired. So I want to make sure the instructions are clear. I'm thinking I will enter the instructions to take 1 pill 2 times a day, which means in the hospital, you'll take 1 pill in the morning and then 1 pill in the evening. Tell me, do you ever have symptoms of feeling dizzy or like you're too tired?
Yes, I do feel dizzy in the morning. Usually after I've had my coffee, maybe an hour or so after breakfast. I just thought it was my coffee.
And it could be, but if it's the medicine, I want us to get that straight so you know exactly how to take it when you leave the hospital and so you don't have those symptoms again. So just to reiterate, I'll enter this in my electronic health record to take 1 pill in the morning and 1 pill in the evening. And we'll get it straightened out while you're here.
Okay, that's fine with me. I've only had this medicine for about a month now, and my body needs time to get used to it. I've tried to manage my blood pressure by decreasing my salt intake, as well as I've started walking in the morning 5 days a week.
Good for you. Those are great things too. And I know these medicines will also help to keep your blood pressure down. It sounds like you're doing a good job. Let's go ahead and keep going. Show me what medicine you take next.
Well, this one is hard to pronounce. I take it for cholesterol.
Good. Is there anything else you take in the morning before breakfast?
The last one on my list is metformin for my blood sugar.
Can you tell me, do you take your blood sugar at home?
I do every morning before breakfast.
Good. Can you tell me when you take this metformin?
I take metformin twice a day, one in the morning before breakfast and the other one in the evening.
Okay, let's go ahead and move that one to the done pile. What about medicines you take that are over the counter? Tell me what else is in your bag.
Yes, I get these from the grocery store. I take 1 baby aspirin for my heart to help prevent a heart attack. I take one vitamin also in the morning before breakfast. And I take one allergy medicine before breakfast.
Thank you for pulling all of these bottles out. Is that everything from your bag?
That's it.
Great.
Okay. Now, if you're presenting this virtually, you then have to kind of negotiate around back to your PowerPoint. And so here we are. And the next slide really introduces us. We're going to now practice doing a teach around medicine. And so you'll see here there's a QR code, but I also, just for everybody else's reference, I have also done two different things. I have created live links so that I can drive everybody to the Health Literacy Texas site to download the role play scenario. So I put that in the chat, as well as I will be able to share it. I've downloaded it myself so I can share my screen and share. So here's the Health Literacy Texas site that everybody can navigate to. Oh, everybody's feeling, they're giving. I appreciate the background, the information that people are talking about in terms of, does the exercise feel condescending? Would have told her something different than what's on the label. I mean, my hope is that your interaction with patients doesn't feel condescending and it's a conversation about the medicines that they take, so that they can be caught by you. And you're right that a medicine review can be done by a nurse, a physician, a pharmacist. There's many people on the team that may be doing a medicine review. Certainly in primary care, lots of times it's the intake nurse that's doing that, but it can be shared amongst and depending on your workflow in your clinic. But here we are coming to an adult medicine review, and you can use this QR code to access the scenario, but we're going to be discussing a case that's a 68-year-old man with diabetes, hypertension, and high cholesterol. He's just been prescribed 2 weeks ago lamidipine for cholesterol. And so the key is to really look at this scenario and make some decisions. So when we go into the breakout rooms, the group can brainstorm over ways that they would organize this medicine review, organize a patient teach to what are the 1 to 3 to 5 key points that you would want to emphasize, and as well. And so once the group brainstorms what the teach would look like, we then ask 2 people to volunteer, one as the patient and one as the clinician, to do that teach. And the rest of the group can download the observer role from the Health Literacy Texas site and do an observation to get a sense of what a quality program could look like if you wanted to do that in your organization. So I am going to work on creating 5 breakout rooms. So you should be invited now. And the rooms are enormous, facilitators. The hard part. Did it only put everybody into 3 rooms?
Yeah, Carol, I was with Tracy.
I know, but it's more that there's only been 3 rooms, like there's no, I can't decide, I can move. I'm gonna move Tracy,
Okay, well, I'm out now, so I don't know. You
then
should,
I'll move you.
yeah.
It's hard for me, there's literally 20 people in each room. It's really hard for me to figure it out. Did you just get an invitation, Teresa? Like I shouldn't be doing these rooms at the same time. And like people are coming into the waiting room. It's a mess. Okay, so Tracy's in room 1.
You don't have to worry about the waiting room. I can take care of that.
Okay, thank you. I'm just having a lot of trouble managing all this. Kate is in room 2. Nobody's in room 3, which means they see room 4 doesn't show who's in there. Okay, so room 3. Teresa, you're in room 4. Room 5. I can't see all the rooms at once. You know what I mean? Like it's not letting me, okay, hang on. It's like taking, I can't see who's in room 5.
Hi, everyone. Are you guys needing someone to lead your session?
Hello, can you hear me?
Yeah.
Hi, I was in room 5 and I was having some issues connecting to the audio, so I had to leave.
Okay.
But I'm happy to be a part of a different discussion group or whatever.
Okay. So is everybody here able to participate? I can lead this session. I don't know. Nobody is unmuting. So
It looks like at least one person is still connecting to audio, but the others may still be connected.
okay. Yeah, I don't know if I can move you. Okay, so if everyone will unmute so I know that you're here, that would be helpful. I only see there's about 4 or 5. Okay, there's 6 or 7 that I see. The rest, I'm not sure what.
Hello, I'm available.
Okay, all right. Well, I'm going to go ahead and get started then. So what we're going to be doing is going over the case study, and we're going to do some role playing. So I'm going to go ahead and share my screen. And the first scenario we're going to look at is the medicine review. So can everybody see the full medicine review document?
Yes.
Okay. So this is a medicine review encounter, and the goal for this visit is to determine what medicines the client is taking and how they are taking them, similar to what you saw in the video. Once we get through reading through this, I'd like to have a couple volunteers to role play this segment. And we have a 68-year-old client with type 2 diabetes, high blood pressure, and high cholesterol. They had an annual physical last month with a primary care provider, and then started a new prescription for Lomepatide for high cholesterol. A cardiologist prescribed the new medicine 2 weeks ago. So some things you should know is that it should be taken once daily with a glass of water without food at least 2 hours after the meal, because taking it with food may increase the risk of GI side effects. They do need liver function test monitoring. They will report nausea, vomiting, fever, jaundice, and flu-like symptoms if they have liver issues, and should not drink more than 1 alcoholic drink per day. They should not eat grapefruit or drink grapefruit juice, and should avoid over-the-counter medications that contain acetaminophen and limit it to 2 grams per day, obviously because of the liver interaction. So how would you organize a medicine review to chunk meds from this list together? What potential risks do you recognize that are barriers for the patient, and how can you overcome these as the provider? So this is from the provider perspective. So let's brainstorm a little bit about that. Does anybody want to comment on how you would organize the medicine review to chunk the meds from this list together? Does anybody have thoughts on that? So maybe chunking them by their what they do, like we could do heart meds, blood pressure meds. We could do, if they were taking any Tylenol, we could, or acetaminophen, we could chunk that with aspirin in terms of pain relief, although aspirin also works for blood thinning. So that could be considered a heart med. What do you guys think? Have you guys done a medication review before? Anybody?
I have not.
Oh, okay. So was the video informative for you in terms of how a medication review is done?
Yes.
Yeah,
Definitely.
so go ahead. Somebody else?
No, definitely. It was great.
Okay, good, good. I'm glad to know it was helpful. Yeah, so a lot of the times patients will be on similar medications that do the same thing, or they will be on medications that interact. Like one time, I'm a registered dietitian. One time I was in the hospital and we had a patient on a low potassium diet, and yet they were getting a potassium IV. So, I mean, there's a lot of things that you can find when you do a medication review. We do a scenario with our students where we throw in a a pet medication, because sometimes, you know, if people are confused or elderly, they may get those medications mixed up. So it tells you a lot when that happens. When you do a medication review, some of them might be outdated. You just really find a lot when you do that. And really, it can be a lifesaver for people if they are doing something inaccurately, such as, drinking more alcohol than they should on that medication, or not getting their liver function test. So it's, that's why medication reviews are so important. So what do you think out of this list of things that we should know? Do you see anything that might be a barrier for the patient, or even, the amount of medications that they take?
I would say it's basically understanding the wording of the instructions, when and how to take the medication. And I deal with patient relations complaints, and sometimes it comes across that they didn't understand and they wanted the provider to spend more time. So this is helpful for me to see how it's actually done. So that way I can, persuade the staff to be more vigilant and more appropriate when telling or explaining to the patients, what to do, how to do it. Because in our minds, we may do this every single day, but for the patient, maybe just new, for them to see this. So they are not familiar, and then they become confused.
Yes, exactly. Yeah, we take for granted that everyone has the same knowledge base that we have when it comes to doing instructions. And that's so our next segment is going to be about teach back, and that will be helpful in terms of not assuming that communication has taken place, that if you do teach back with them, you can confirm that they understood, and chunk and check some of these things that are potentially overwhelming when you give it to them all at one time. So yeah, if there's misunderstanding, especially, when to take the medication in terms of the food, and the fact that they need this liver function test, and what symptoms they should be looking for, all of these things. So definitely can get confusing. And so you gave us the answer of how to overcome those as a provider is, try to make sure that we're communicating in a way that's clear. Sarah? Did you raise your hand?
Yes.
Okay.
Yes, I have a question. So I may be getting ahead of I may be getting ahead of you, but
that's okay.
I'm just wondering if you have any ideas for how to handle working with patients who have low health literacy, who have low literacy, maybe English is their second language, maybe they don't speak it very well, they don't really understand. So do you have any suggestions for using like images or other things to help people to visually understand clearly what they're supposed to do and when, and even if they don't completely understand, everything on the bottle?
Yeah, for sure. So there's a lot of things to unpack in everything you just said. So definitely images are encouraged in terms of being health literate, but they have to be meaningful images, not just for decoration, of course. They have to help with understanding. Probably the biggest struggle, I think, is having materials that are health literate. And it's very difficult to do that because there's so many materials that your healthcare system or your community organization or wherever you practice need to transform to be health literate. I've done a lot of that work in my career, and I know that it takes someone with a lot of experience in it to do it. So trying to get all of the materials that you're giving out to a health literate would be the goal. But it takes time. And in the meantime, if people do have limited English proficiency, you know, of course, best case scenario is to have a bilingual translator or employee. Typically, you'd prefer that they be, you know, a certified translator, but we know that people work in circumstances that we can't always have best case scenario. But that's what's, you know, preferred from the regulatory systems that oversee healthcare. And then too, asking them what language they prefer, because if they speak both, they may prefer it in Spanish. And so that's what we should provide it in. And that's actually mandated by Joint Commission if you happen to be in a healthcare setting. So there's a lot that goes into health literacy, and I encourage you all, if you haven't spent a lot of time in this space, to start spending some time in this space, because it really can be the bridge between helping people in general, patients, clients, whoever you are and whoever you're working with, understand and be able to act on health information. So from the client's perspective, if we're this same client that we've just been describing, and we want to understand the information, you know, we had this physical last month, and we know that we have an issue that needs to be taken care of, this type 2 diabetes, high blood pressure, high cholesterol. I mean, I have friends that are dealing with these issues and don't really know what to do. And so to some extent, they want to just ignore it. But if they do happen to see a healthcare provider and get the diagnosis and the medications prescribed, you know, we want them to understand, and they want to understand. So, you know, as the patient, you see that your cardiologist prescribed this for cholesterol. You already take 2 other cholesterol medicines. Many of your family members have high cholesterol as well. So you've come to the clinic for this brown bag medicine review. You brought your medicine bottles as directed, including over-the-counter medicines, and you have a follow-up appointment with your cardiologist in 2 weeks for labs. Tired because you haven't been sleeping, and you manage most of your medicines by taking them in the morning. You take 1 tablet or pill of each medicine. You have not had side effects at all, and your normal routine consists of. So this is what you take in the morning before breakfast. In the evening, you take these medications and over-the-counter acetaminophen. So apparently we're closing in 55 seconds. So I'm just going to real quick, you know, clearly here's the new med, and they're taking it in the morning before breakfast. So how fast are they going to eat breakfast? And then looking at the fact that they take acetaminophen, how often, how much, we need to know that. So there's, you know, a lot of things that we could do to help with understanding and, you know, help the patient. So using the word medicine instead of medication. Goal is for the client to explain back to you. Again, it's kind of embedding teach back into the medication review. And then knowing that they were already on a couple of medications, then making sure that they communicate what other providers are prescribing. And the provider should recommend the client bring the medicines every time they come.
Hey, Teresa, we're all coming back to the main room now.
Okay.
Hey, Brandon, is there any way you can help me get everybody into 5 breakout rooms and the facilitators into 5 breakout rooms? It's almost impossible for me to organize those logistics and facilitate at the same time. And so one room ended up with no facilitator, and Teresa ended up in the main room with only a few participants, but then there was a room with 20 that had no facilitator.
Yes, ma'am. I can take care of that for you.
That would be really great. I mean, it just, because I just can't look at all that at the same time. Thank you. All right. Welcome back, everybody. There was a lot of good points that people brought up in the breakout rooms. And I appreciate some of the comments that were really said about, you know, that the scenarios are missing information in terms of social determinants of health and other issues that clients might be, or patients may be struggling with. And I totally appreciate that. But I really want to encourage that when you're doing a learning activity, you know, you limit the scope so that you can focus on the teaching of the medicines. And I understand that that is in a very, you know, limited way. But we're trying to work on a specific health literacy skill here. But feel free as you do this workshop to, you know, morph it into something of your own that works for you. All right, so the next part would be introducing, Teach Back, which is the next health literacy best practice that we focus on. What I want to encourage you to think about, and I think everybody on this call already knows this, but to other people that you may be training in your organization, this may be relatively new information for them, but really emphasize that Teach Back is not a test of patient knowledge. Yes, you want to make sure they've comprehended information, but really think about it as a test on how well you have explained something. And this is a real paradigm shift for people, and they really struggle and push back against it. That it's really how clear are we being. It's also important for everybody to find their own individual way to ask for a teach back. So we have different prompts, but people should morph them to something that makes them, that's comfortable for them. I usually say, we've covered a lot today. I want to make sure I was clear. Can you tell me in your own words what you're going to do X? When somebody has to reframe something in their own words, in some ways that is also reinforcing what they have learned in their mind. It's an opportunity for them to practice kind of what they've learned. It also is an opportunity for you to discover any misunderstandings, and you can clarify information as you need to. I encourage, and when I'm giving this workshop, for people to try it with one patient, and then when they feel comfortable to scale it up as they do their work. So I'm going to play another video. You can see right here in the slide deck, it comes right up. Oh, do I have to make sure? Do I have to set the sound again? Let's see. Tell me right away if you don't hear sound. Sound or no sound?
Yep.
You hear it?
Yes.
Okay. Thank you.
Hi, Kate. Let's switch seats really quickly. All right. So your mom's finishing up at the front desk, and she'll be in a few minutes. So how's it going?
Good.
Good. Well, the last time I talked to you, your swim team was going to a meet, and you were doing the backstroke. So how'd it go?
It went all right. Coach says backstroke is my stroke.
Oh, well, that's good to hear. It's always good to have improvement when you try really hard at something, right?
Right.
All right. Well, I want to talk to you a few minutes about managing your low blood sugar. So now that you're getting older, you can do some things for yourself. So do you know what it feels like to have a low?
Yes, my stomach hurts and I'm really shaky and I'm really hungry.
Yes, a lot of kids tell me that's how they feel when they're low. So I'm glad that you know what it feels like. But it's always best to check your blood sugar if you think you're low. Do you usually check your blood sugar when you're low?
Sometimes, I don't know.
Well, that's okay. I want to tell you why it's important to check your blood sugar when you think you're low. We want to know what your blood sugar is doing. Sometimes you think you might be low, but you're not really low, less than 70. Sometimes you're not able to check your blood sugar because you don't have your glucometer, So it's always best to treat it if you think you're low. Can you tell me in your own words why you think it's important to check your blood sugar?
I need to check my blood sugar if I feel like I'm low because I need to know what my blood sugar is doing.
Yes, exactly. So if you think you're low, you want to check your blood sugar and make sure it is actually low. So now I want you to think about the 15-15 rule, which means if your blood sugar is low, less than 70, you want to take in 15 grams of carbs and wait 15 minutes. Then you check your blood sugar again. If it's still less than 70, then you want to take another 15 grams of carbs and then what?
15 minutes.
Yes, you want to wait 15 minutes. So when I say 15 grams of carbs, that means either 3 glucose tablets or a juice box. All right, well, let's take a break. I know I just went over a whole lot of information with you. So I want to make sure I did a good job explaining to you the 15-15 rule. Can you tell me in your own words what the 15-15 rule is?
Okay, if I feel low, then I need to eat 15 grams of carbs. If I still don't feel good, I need to eat more carbs until I feel better.
I'm sorry, I need to explain the 15-15 rule a little bit better to you. So you got the first part correct, where if you feel like you're low, you check your blood sugar, and if it's less than 70, you take 15 grams of carbs, and then you wait 15 minutes. Then you need to recheck your blood sugar and see if it's actually low again. And then if it is low, you take 15 more grams of carbs. So it's really important to wait that 15 minutes before you recheck your blood sugar. Because if you keep eating carbs without checking your blood sugar, what do you think would happen?
My blood
It's hurting, you might feel shaky. So it's really important to remember the 15-15 rule to make sure you wait that 15 minutes. So if you're low, less than 70, you take 15 grams of carbs and then wait 15 minutes. If you're still low, then you take another 15 grams of carbs and then what?
and then wait 15 minutes.
That's right. So I think you got it. And so I want to give you a cheat sheet. So if you forget what the 15-15 rule is. But before we finish, I want you to explain to me in your own words one more time what the 15-15 rule means.
If I'm low, I need to check my sugar first, actually. And then if I'm low, I need to eat 15 grams of carbs or 3 glucose tablets and wait 15 minutes. If I'm still below 70, then I can eat 3 more glucose tablets and wait another 15 minutes.
All right, you got it. Oh, here comes your mom. So let's explain it to her again.
All right.
Okay, this moves us right into another scenario. Again, you can tell participants to use the QR code to use their phone camera to pull it up on their phone. Or you can share your screen with it if you've downloaded it ahead of time, or you can share the Health Literacy Texas link in the chat when you get into a breakout room for them to be able to download it there. But this is a teach back scenario where we have a 9-year-old boy who is post-op tonsillectomy and adenoidectomy. He's being discharged to home. Pain management is a concern. Your task as a provider is to take a few minutes to plan your teaching, making only 1 to 3 key points before checking for comprehension. And you can do a teach back to make sure you were clear. And so I'm going to, Brandon, if you can put us into breakout rooms, we can go from there.
I don't seem to be in a breakout room.
Thank you, Brandon. That was a lot easier for me. I didn't break into a full sweat trying to multitask.
My pleasure.
It's one thing to manage breakout rooms when there's 30 people, but when there's 100 and some, it just.
As a training session for Teach Back?
I'm sorry?
Oh, there we go.
All right, we're all back in the main room. Any thoughts, any like aha moments in the training for Teach Back?
I'm not sure if this is an aha for everyone, but how important is teamwork, especially when dealing with multiple physicians or providers, and as a parent, and having the confidence to know that if you couldn't hear something the first time because you're just so totally stressed out, you can pick up the phone and call the pharmacist or call the nurse or call the doctor's office and say, okay, can you explain this to me again?
Well, it's interesting that you bring that up. Brennan and I are handling this right now in an ENT clinic. And you're right, there is teamwork and there's workflow in order for everybody to be reinforcing the same information at a time that is most relevant to parents. And so we've been having a lot of conversation about that. When you teach about post-op pain management, it may be during a clinic visit, and then the surgery is 2-4 weeks later, they get another teach, but their child is coming out of the operating room, so they're not really hearing it well. So what are other ways to give them that information that so that it's very relevant at the moment and accessible at the moment? So you bring up a very good point. So thank you. I'm going to keep us moving. We are pretty much almost on the workshop. We have a Kahoot game that finishes us out to kind of reinforce. And I don't know if we can try. I don't know if people have downloaded the app or ever played Kahoot. If you, my students all know how to do this, but we can see. So I, right from the PowerPoint, you can click on it. I always continue as a guest. And I play classic mode. And now you'll see a pin will come up. And if you have the Kahoot app, you can add this pin in. And I'm just going to see if any players join. We'll just see how we're doing here. I'm going to join in case nobody else does.
I'm waiting for it to download.
Yeah, so if you're doing this workshop, it's great to tell people. Mine's asking me to upgrade for a lot of money. I don't want to do that.
You can do it online through your computer. It's just kahoot.it. So you don't have to download it, and it's a lot faster.
Thank you. Can you give that directions again? You're absolutely right.
It's kahoot.it. And then all you have to do is put in the game pin, and then you're automatically in.
Thank you, Darcel.
You're welcome, Raphael.
Scan that QR code, it opened directly into just my web browser. So it brought me right into the game too.
Yeah, although it's telling, for me, it's telling me to upgrade. But, okay, we're gonna start. Just really want to give people a sense of, I'll give people a couple more minutes. All right, I'm going to start because I'm really watching time, even though I know I'm going to frustrate people that are almost on. Okay. So you'll pick the color that's the right answer. We have a very health literate crowd. All right, Susie. Limit information to 2 to 3 key points. Like I said, we have a very health literate crowd. I love it.
Good job, guys.
Yeah, right? That's right. So should not distract from the text. Ideally, your graphics match what you're saying. Oh, the Susies are moving up. So this would have all been in the PowerPoint that I sped through, but so you can see that this can be kind of a fun way to reinforce the information for people. And you can do this in a large conference room with 500 people, right? So the 1 in 3, that's based on the null data that was done way back in 2003, but nobody has updated that. I don't know what happened to Susie and Susie. They were at the top before. Well done. The words that are easy to understand, and sometimes, of course, we have to use medical jargon, but then it should be explained what that is. So obviously when you're playing this game, you can like try and rev it up and create competition and all that, but so chunk and check, not overwhelming people by breaking down information into small bits. And I find for clinicians, especially really experienced clinicians, this is the hardest thing for them. In fact, their knowledge almost becomes like somebody on Tuesday was talking about teach back and chunking and checking, that the more expert you are, the harder it is for you to actually chunk information because you're so used to and know it so comprehensively. And I think we probably all could provide examples of that. We probably all have stories. I think this part's always kind of fun. All right, so that's the Kahoot game. We'll leave the site, come back to the PowerPoint. So then the most important thing for this project or this workshop was funded by the National Networks of Library of Medicine. And they really want everybody to complete a participant evaluation. So if you could take a minute to beam on that QR code and complete it. I'm also trying to, I don't know how to, can somebody, does somebody have the link to put it in the chat by any chance? Again, the Health Literacy, well, the Health Literacy Texas site will do it, but I just can't. Hang on. So you can also access it from the Health Literacy Texas site, the evaluation. We really appreciate it. Janice, thank you for that advice about being really respectful with teach back. And I agree. It's very respectful to address people by Mr. or Mrs. or Ms., especially in BIPOC populations. And also, truthfully, in the South here. I moved from the Northeast to the South, and there's just different ways of showing respect. So I appreciate that. So overall, how prepared do people feel to be able to use these materials, add on to them, to do training in your facilities? And thank you for all the comments. I'm just starting to catch up on them. Janice, can you tell me what, oh, you were saying about the med review, that it could trigger feeling less than and perhaps make people feel less than?
Absolutely. And I have observed instances when particularly a Black older patient will say, don't call me by my first name. Nurses especially seem resentful of that. And I actually, I am a health professional in my community, and I actually sit on the board of health for my county. And I don't give anyone permission to call me by my first name unless I'm comfortable with you doing it. And I have said to nurses, if you want me to call you Miss John, Mr. Joe, or whatever, just tell me. I don't have an issue with that. And they will prefer to call me nothing. It's like I'm not even in the room. And I've seen them do that with older, especially, or just other African American, mostly women, who say, I am Ms. or Mrs. We have to be respectful and building relationships that facilitate getting good information, or the exchange, I should say, of good information. And this is one of those ways we are going to begin to close the health disparities in our nation. It's RESPECT. That sounds simple, but for a lot of people, it's not.
Sure, I appreciate that feedback. So thank you so much for attending our workshop. I hope that you can take these materials. They live on the Health Literacy Texas site. Use them, add to them, make your stories yours. And we'd love to see more training out there in the world, especially with COVID. It really has limited our ability to push it out. And so we're really hoping that as everybody returns to their organizations, that they can use the information and bring it to their people. So thank you for all your points. And we can't be reminded enough to be respectful. So I appreciate that, Janice. All right, so thank you very much. Can the facilitator stay on the call, Brandon? Can we stay on for 5 minutes, please?
Certainly.